Hi everyone, hope you're well. Welcome to Spill the Beans. My name's Duncan Goldie. My guest this week is Conor Burke, who is the chair at Improve and managing director of his own consultancy, CPB Consulting. Conor has spent a career in NHS transformation and commissioning style roles. He's been operated as a chief executive within the NHS, and now he's kind of trying to make more impact and help drag the NHS through innovation in digital processes and systems through a consulting business that he set up. So really interesting to chat with Conor and get his views on the digital healthcare industry as a whole and the types of businesses that he's supporting as well. So really insightful and interesting chat with him. I really enjoyed it, and I hope you guys do too. Great, Conor. Hi, thank you so much for taking part in the podcast with me this week. Tell me, whereabouts in the world are you right now? Where are you based?
Hi, Duncan. I'm in not so sunny Hertfordshire at the moment. I'm based in a place called Bishop Stortford, which is not far from Stansted Airport. So yeah, it's good transport links, good access to London, and also if you want to go up to Midlands or North. But today is particularly grey, sadly.
That's I'm sure the same case for a lot of people. So you obviously mentioned access into London and stuff like that. Is that the kind of non-pandemic life for you? Are you normally sort of traveling around, and how has it been different, I suppose, during the pandemic?
Yeah, I mean, no 2 weeks are the same, really. I mean, 1 week I could be in meetings in London, kind of talking to clients or potential clients. Another week I could be, with an NHS organisation up in the northwest, doing some work around their strategy, or increasingly clearly on lots of calls, potentially with international clients too, who want to get into and understand the UK health market and think about how they can help. So hugely variable normally, and actually at the moment it's quite variable too. So off to a client meeting on Wednesday in West London with a large pharmaceutical global company about how do they reposition in the revised context of what they're experiencing at the moment and the need to change. So it feels like everybody needs to change at the moment. I guess the real challenge is going to be, what's the sweet spot and how do people come together and collaborate around the change and add value to each other?
Yeah, definitely. I mean, it's you obviously touched on a lot of points there, which kind of summarizes, I suppose, what it is that you do and how you're affiliated with, the NHS now as a bit of a sort of, intermediary broker. To go back to the kind of start of your career and add a bit of context around, how you developed your, clinical understanding. Talk me through sort of how you very first got into the healthcare industry.
Yeah, I mean, a curious career, really, I suppose, in many respects. So I started my career doing a degree in computer science, which in the 80s, there weren't anything like a smartphone or even a laptop or even a desktop. So I wasn't really into technology per se at the time. So left that, having done 3 years in Liverpool, and decided, of all of things, to become an occupational therapist. Don't know why, but it was, felt like I wanted to add value back in and really get close to making a difference to people's lives. So I did that for about 4 or 5 years, and then decided to go into NHS management, working for a big acute hospital in East London. So cut my teeth there, and became the clinical risk manager for that organisation. For a while, which again, was a tough environment in the 90s around quality, safety, with big litigation issues and big safety issues. So following that, I wanted to really get some experience of a more commercial environment. So I got approached by a small niche boutique management consulting company focusing on risk management. And then over that 8-year period, ended up working for a few different companies, ending up at one of the big four, working on the national programme for IT. That was probably around about 2013, 2014. and then decided I really wanted to make a difference and come back in as a bit of a hero, and got offered a job with a primary care trust, as was at the time in the NHS, a commissioning organisation in East London, and became the chief executive after a few years of leading their strategy and organisational development. And then the Lansley changes came along, and we all know what happened as a result of that. Big changes to the NHS in terms of form and function, an operating model, and clinical commissioning groups were born. And I was part of that, becoming a chief officer for 3 clinical commissioning groups in East London for I think a 5-6 year period. 2 years ago, I got an opportunity to do something different, and grasped it with both hands, and that's when I established CPB, my own kind of boutique consulting company, which I can say more about, and also started working with some interesting colleagues, more recently a company called Improve, but also working alongside the NHS and also with pharma companies. So happy to say a bit more about that if it's helpful.
Yeah, definitely. I mean, it's obviously a very interesting career path that you've come down, and I guess, you know, you mentioned there wanting to come in and sort of make some organizational change and transformation. You've obviously experienced both sides of that now, having done it, trying to do it from within, and then trying to do it, you know, as more of a sort of, like I said, more of an analyst now. How could you sort of differentiate between the two? And I suppose over time, have you seen the NHS become more open to change or less open to change?
I think it's a really great question, and I think it depends where you are in the organisation. I think if you're at the front line, you're constantly trying to innovate and change services, improve services for patients, deliver, you know, services of high quality, and there's, you know, much more scope, I think, for doing change at that level, either as a clinician, as a service manager, and really taking some leadership around how you would do service redesign and transformation. I think as I got into more senior bits of my career, particularly within the NHS, what I slowly recognised was that the capacity to deliver big change at scale was limited. And lots of reasons for that, because, you know, the NHS essentially is a political organisation. And so a lot of the change that needs to happen has to be instigated from national bodies. And often they will have their own agenda according to the latest political party that's in power. And clearly the need to strategically change is becoming more acute than ever. But nevertheless, the way to drive that with the constant reorganisations in the NHS has been quite difficult to do. And certainly in my last, I suppose, 10 years or so in the NHS, what I really experienced was that I was effectively simply managing risk. I was managing risk on behalf of patients, my staff, the organisation, as well as risk on behalf of national bodies. So when you're kind of just managing risk and keeping the boat headed in the right direction, what is really difficult to do is to radically change the direction and the destination of that boat. And so what I feel now is I probably am more able to influence change, more able to challenge and to help the NHS think about different ways of doing things, and also introduce them to people that are innovating, people that are doing things very, very differently in other places and have proven their credibility around absolutely delivering that change in a way that is adding value. So I think, you know, I'm happier doing what I'm doing at the moment. Who knows how long that will last? But equally, it's more satisfying in respect of the value that I feel I'm delivering, both for the people that engage me, as well as ultimately for, you know, the services and the patients that are experiencing them.
Yeah, absolutely. And I mean, is that because you feel that you've got more access to, I suppose, the different channels of innovation and more time to kind of spend, reviewing the latest innovative products that have come out there? Or, I mean, what's the reason for that, would you say?
Yeah, I think that's absolutely right. I think a big degree of it is that I've just got the headroom, and I've got the motivation to want to look at the latest research, the latest technologies, the latest science, the latest around, the rise of the patient as a consumer, as a first to a passive recipient of care, and doing the thinking, and then converting that thinking into, okay, how can we actually make this real and happen? If I was in the NHS, I suspect, my 12-hour days would be filled with lots of different types of business meeting, board meetings, performance meetings, management meetings, and while everybody wants to improve services for patients and really wants to try and make that happen, when you're dealing with a highly complex organization or group of organizations, because of course the NHS is a concept, not really an organization, it's really difficult to get everything aligned so that you can execute change and deliver the benefits in the way that you really want to. So yeah, I'm really fortunate and grateful really that I've had this opportunity to actually reinvent something that I really enjoy and reinvent myself in a place that actually I think I'm adding real value and making a difference to people.
Definitely. So I know that there's obviously, the magnifying glass is really on the innovation piece in the healthcare industry at the moment as a result of the pandemic. You mentioned how, CPB and you went in this new direction a couple of years ago. That was obviously prior to a pandemic when no one even really knew what coronavirus was. So what can you sort of say about what led you down that path initially, and then how has that changed or escalated through the pandemic?
Yeah, I mean, I think initially I really wanted to see change happen. I really wanted to see the rhetoric turn into reality and be part of that. Having had good 10 years of being a chief executive, understanding how buying decisions are made and managing, an effective bureaucracy in effect, you are distant from feeling the change and the benefits it delivers. So I really wanted to get back into the weeds and actually see how I can help improve things. So I suppose over the last couple of years, I've been, having loads of conversations and reaching out to innovators, reaching out to early stage companies and new businesses that, equally have the same values as me and want to do that stuff, but find it quite difficult to navigate the public sector and NHS markets. And so building that relationship and giving them some of the benefits and insights of what I've done previously and how decisions are made, how in reality things work on the ground rather than just listening to the policy or reading the latest plan. I think, I hadn't appreciated how much value that adds to people when they're not part of that sort of environment. So from that, and just doing that, reaching out, all of a sudden I had, 3 or 4 clients that wanted to, me to keep working with them, whether that's through coaching or mentoring, or whether that was helping them develop a clear strategy or clear go-to-market plan. And of course, I still maintain my NHS work and relationships. So I still do work for the NHS Transformation Unit, who are doing delivery on the ground, particularly in the Northwest. And helping organisations change. And I still do pieces of work for the likes of the NHS Confederation or the NHS providers. So what I can also then do potentially is connect some of these pieces together to develop those meaningful relationships and be able to then, from that, help people develop partnerships that add value in this space. What we've noticed as a result of COVID in particular, as everyone will see, is the massive acceleration of all of that. The NHS wants support and help. It has limited capacity for obvious reasons, and that's not going away in the short term. It's got some very big problems too around, backlog and demand, and who knows what's going to be the legacy of COVID as a result of long COVID and other types of things. So those problems are only going to get more and more acute, and At the same time, the NHS is trying to reorganise itself in a way that is much more around value-based care, rather than just plugging in a whole load of extra money and cost and wanting to measure outcomes. But in parallel to that, we're seeing a whole load of stuff happening in science and industry around the opportunity for data, for AI, for algorithms and machine learning, and thinking through how diagnostics can be much more upstream around prevention, and a load of innovative technologies, as well as a whole load of biopharma products, where the combination of that together with the NHS could add real value. And I suppose the other thing I'm really noticing is the voice of the consumer. I think patients and service users are getting more and more of a voice. Whether people listen at the moment is a question, but more of a voice through the media, through lobbying groups, and through the ability to purchase self-care and health and well-being products. And you only have to look at wearables and smartphones to realize where that's going in the medium term. So the trick for me is going to be, how do you align all of those different disruptions and different technologies and different opportunities? And that sounds simple to do, but when you're working with global pharma companies on one side, with a highly established NHS model on another side, and then with users that want quick, urgent care change to address their needs, it's pretty challenging to do. But I think everyone gets the need to do it. What I am hoping to do, and increasingly am doing, is helping people create those partnerships focused on things like personalized health and care, thinking through the opportunity of doing something different around a particular care model or a disease area, and helping those partners through industry, tech, academia, and users come together in a way that they've never done before as a collaborative to do the right thing.
Yeah, absolutely. It's such a diverse, I suppose, range of issues that have so many different applications and so many different implications, and there's obviously a wide range of solutions as well. Is there anything through the sort of transformation work that you're doing within the NHS that you're seeing as a particular focus, and anything that's kind of like a real driving change at the moment?
Yeah, I think strangely enough, I mean, there are lots of focuses, and I could go into loads of different channels, but the thing that I suppose is really exciting and possibly a wake-up call for the NHS is the workforce. I think the workforce drivers around not enough, not being able to afford, the diversity of the workforce, and all of that's been exposed, I think, through COVID, and the need to really think about getting the best value and productivity from workforce. So that can either be through tools and platforms where you can deploy people in a more effective way, through rostering and more efficiency between and across organizations. So working with a provider in that space at the moment called Circular Wave, which is doing some really interesting stuff in primary care and across PCNs and systems. But equally, the workforce in terms of health and well-being, communication, resilience, being able to adapt, education and training, and doing that in a remote way, so you're reducing risk from the context that we have at the moment. So lots of interesting suppliers in that space around virtual reality, a company working with called Verti, which is a National Innovation Accelerator, that potentially has a real strong offer in that area to keep people healthy, well, and mindful. So that whole mental health virtual support for staff is really, really interesting. And then I think the other interesting bit is, as we move to measuring outcomes, there are some really interesting technologies out there. So working with a company called Patient Experience Platform that has an algorithm-based data extraction tool that looks at social media and is able to forecast whether or not an organization is likely to get a poor or a good CQC rating based on social media feedback from patients. So I think the outcome-based measurement is going to start driving a whole load of behaviors and service transformation in a way that has never been done before. And I think until relatively recent, we didn't have that data. I think everything is underpinned by access to the data of various different things and how data is used for different purposes, whether it's staff wellbeing, patient improvement, or measuring system effectiveness. But I think, you know, the quicker and more effectively we can get to the data and then use it in the right way for patient benefit, I think that will drive massive acceleration of transformation.
Yeah, definitely. Look, we're almost out of time, Conor. I know it flies past a little bit, and it's obviously there's lots more we could talk about. I suppose just to finish off, I mean, if you would sort of be in a conversation with any kind of, you know, early stage innovative product, potentially with, you know, strong clinical application, I know that it's quite a sort of daunting prospect trying to be able to get that product released, and some products just simply don't try within the NHS a lot of the time because it's too difficult to get that right traction. What's the kind of piece of advice that you would pass through to them? Probably the most toughest question to finish.
Well, it is and it isn't. Giving advice is never tough. It's converting the advice into action, which is you know, more challenging. I think people talk a lot about the problem, and I think they're absolutely right to do that. So understanding the problem for the customer, the client, the NHS, and what it's trying to solve. And I think there's an awful lot in that, but I think it's too simplified in a way as, you know, as the issue. I think it's understanding the problem in a context of what is the policy and what's the need locally for somebody that wants to buy stuff. So the NHS has got loads of problems and it's got loads of solutions out there in the marketplace, you know, hundreds, thousands of options. So really understanding who your buyer is and what's in it for them, I think is the real challenge, and how they would want to demonstrate a difference. Whether that's the solving of a problem or whether it's the meeting of their ambition for their local area. So I think building that relationship, listening to what the person is experiencing and really adjusting your product, your offer and your proposition to meet those needs, not just problems, is where I would focus on. Now that's a long process to develop, but I think for the NHS it is very much about the relationships and understanding what people need and want in that context. The only other thing I would add is, and once you've got those relationships and people trust you and people find you credible, I think the benefit of investing in that process is that people will stay with you. The NHS, due to its values, is very loyal. So I would focus on that.
Yeah, definitely. Well, look, it's obviously, you know, rapidly changing times, and you know, you obviously got really good insights into that from, you know, both sides of it. So it's really important information, I think, for a lot of people. If they did want to sort of find out and potentially reach out and you know, discuss how you might be able to help them with the work that you're doing, what's the best way for people to stay in touch?
Just go onto the website, cpbconsulting.co.uk. All my contact details are on there. You know, happy for people to drop me a text or a WhatsApp or drop me an email. And I'm fairly prevalent on LinkedIn as well, if you want to add me and connect with me.
Perfect. We'll put the links to those in the summary of the podcast. But for now, look, Conor, thank you so much for taking the time to chat with me. Really interesting. And I'm sure there'll be lots of conversations that will derive off the back of it.
Brilliant. Thanks, Duncan. Thanks for having me.
Enjoy the grey weather. So that's it for us this week then, guys. Thanks very much to Conor for taking the time out of his busy schedule to be on the podcast. Again, if you do have any questions for Conor, if you want to find out more about the work that he's doing from an advisory perspective, from a transformation perspective within the NHS, from a consulting perspective, through the work that he's doing at Improve, anything like that at all, then there's some links to be able to get in contact with him in the summary of this podcast. Apart from that, I hope you guys all stay well, stay healthy, stay safe, and we'll see you next week.
Spilling the Beans Digital Health Podcast is aimed at members of the digital health community globally. with guests from the United Kingdom, Australia and the United States. The podcast is available through all major podcast distributors as well as on YouTube. The show is sponsored by Woodrow Mercer Technology and Woodrow Mercer Digital Health.